Okay, we are going to delve into a long chapter that has to do with specialization. Chapter 14 and chapter 12 gave an overview and instruction on methods. And those methods could likely become a specialization, like maybe you specialized in fluid movement, or you might specialize in connective tissue type approaches, or you might really dive in and learn about hydrotherapy and make that be a major part of your professional practice. More than likely, though, specialization is going to have to do with a particular group of people that share some commonalities. So an example of that is athletes. They have performance demand and physical movement as part of what they do. Now, anybody who has performance demand and moves, which is everybody, it can benefit from the same kind of targeted approach as any athlete can. Just like another targeted approach, depending on population, is pre and postnatal. And many of the methods, interestingly, that I have used over the years with athletes were originally learned in relationship to prenatal. A lot of it having to do with common conditions, especially in the latter stages of pregnancy, due to joint laxity. So hopefully we've gotten beyond sideline position being delegated to the prenatal type massage and incorporated it as a general process. That's how you have been taught at Health Enrichment Center. But at a lot of places, the only place that sideline is used is in the idea of adapting position for individuals that are pregnant. So again, as we move into these later chapters, as you've seen, we're starting to really see that spiral tightening where there's a lot of overlap. Chapters 11 and 12, too, in Essential Science, they also are important when you're thinking about a particular population, a population category based on breakdown in a particular system, like acute pain or not acute pain, but chronic pain, or even, again, our example of pregnancy. Part of the specialization, in fact, a major part of that is knowing more around the changes and demands in the anatomy, physiology, and how to adapt massage to support the most optimal function possible in that regard. So the general massage, the content that we taught you up to chapter 10, and some incorporation of the content in chapter 12, coupled with the careful assessment and safety first concept of chapter 11, should indicate that it should provide the platform where you can provide massage to almost everybody. But as a professional, it is an important self-teaching or taking quality continuing education to be able to learn more if you're going to choose to target a population. Not necessarily more about massage, but more about that population. So this chapter targets that. It's not about massage, although there's suggestions on how to adapt massage, but it's an overview of the most common populations that you're going to encounter. And then depending, it also can be a launch pad for continued self-study, to know more about the condition, potentially a cross-train. I do have a section on animal massages. So I have the only one in the textbooks that are used on animal massage. But our companions are very important to people, and they're important to your clients. And so if you can cross over and provide some massage tips and some demonstration, people will appreciate that. Clients will appreciate that. If you want to do this as a major part of your professional practice, then you need to know more about animals and animal handling. And for small animals, grooming. Not that you're going to be a groomer, but the process of learning how to groom gives you the necessary background about how to hold an animal, how to work around, a path and a sequence. And with horses, a lot of people are interested in horses, even learning some special care tactics for horse care from somebody who is a horse person, so that you know how to move around. And in that particular segment, there's a large section on pain. And it's very interesting to me, the behaviors and the overlap of animal companions and pain, and humans in pain. And sometimes if you recognize the crossover, even if a client can't articulate clearly their experience of discomfort, maybe you can rely on some of this information to give you some insight and guide your questioning. So we'll probably divide this chapter into segments only because there are a lot of populations to consider. But we're not going to have what I would consider an in-depth discussion that would expand tremendously on any particular areas of compromise, dysfunction, strain, pathology, etc. With the information that's in this chapter, you will be able to adapt to these various populations with some guidance. Like if you work in a hospital setting in acute care, which is primarily going to be palliative, you have the support system of the nursing staff. As long as the person's condition is pretty stable, and you are aware of where a need for referral can possibly come forth, then this is enough for you to make good critical thinking, clinical reasoning decisions to adapt massage to these various populations. But the more overarching the condition is and its influence, the more fragile the client is, the more additional education you would need. Again, not about massage, but how, so remember, in our professional practice framework, we have our skills, but we also have our client-centered approach. So a lot of the information in this chapter has to do with that aspect. you already should be experiencing a level of confidence in adapting massage. And in all situations, it's important to know what not to do, and to not try to be too aggressive, and work your way through a series of massage sessions with somebody so that you can see what their response is and their adaptive capacity. So also, as this introduction to this, the other thing that you can take a look here and see if there is a particular draw to learn more about working with a particular population. And then you can seek out opportunities to work, to put yourself in professional practice where you can learn more about how to do that. And when I get to individual sections, if there is a pathway to a more extensive education for continuing education and professional development, I will mention that. Okay, so here we go. Share screen. So the title here is important. It's not about a particular style of massage. It's about adapting massage, and that has to do with our modifiers. We determine a outcome. Some of these populations have more common outcomes. But remember, the general massage with relaxation, a little bit of restorative capacity, support, and stress management is the foundation of all of these adaptations. But some of them might indicate that we change our duration, maybe, and frequency. Maybe it would be better to work for a shorter period of time more often. It might require that we learn a little bit more about, let's say, inflammation and how we need to be progressive in how we apply massage for acute productive inflammation during a wound healing process. That would be an example in a surgical situation. In the prenatal area, we would want to learn more about the normal reproductive process development of the infant, birth, that sort of thing. In pediatrics, it depends. It really depends on other conditions that might be involved with that. You can have a pediatric athlete, or you can have a pediatric individual who has had surgery, or you can have a pediatric client that just isn't sleeping very well, or you're teaching a caregiver. So in the geriatric arena, there's a lot of value for massage, for relaxation, stress management, pain management, importance of restorative care and condition management, not a ton of therapeutic change, and a palliative approach as well can be very valuable. So each one of these areas that we're looking at can have a category of care, a common outcome, and then some common shifts in the modifiers, which would be your pressure depth, your speed, your frequency, your drag. Those are the modifiers. Okay. So here are the chapter objectives. A study strategy reminder is that you can go back and look at these objectives after you've absorbed this chapter, and then you can see if you can come up with a narrative to explain that to somebody. So let's say somebody asks you if there's anything that you could do for a geriatric dog with some joint pain. And so this chapter can give you some guidance on that, and then you can use this objective as a launch pad. If you can explain things pretty succinctly and it's logical and it makes sense, this is a strategy we'll use during the class, our classroom and Zoom. So that's a way to perfect your knowledge base on this. Here are your terms that you need to be able to use. Here's an overview of the chapter. Focus on professionalism. I already talked about the idea of specialization here. And then we start right out with animal massage. And these are, it was hard for me to figure out how to organize this chapter. I've done it different ways in different editions. Sometimes it's by alphabetical order, and sometimes it's by trying to cluster into common categories. And so this is a little bit of both, the organization here. So if you really, really, really want to work with animals, then the cross train would be vet tech. So I'd already mentioned grooming, but if you really want to do this, then I would combine it with vet tech. And that's another vocationally trained occupation. And you'd be able to really expand your skill set if you were working in a veterinary setting with this. So it depends on how far you want to go with this and to your level of specialization. But if you really want to get into some of these, then you're likely going to have to combine it with some sort of cross train. Okay, so the way you learn about a targeted population, in this case animals, is that you have to build your body of knowledge. So that's your anatomy, physiology. I'm going to take a cup of coffee, drink a coffee here. I'm doing this in the morning. So again, even if you don't fully become a veterinary technician, there are textbooks you can get and you can read through those. So you're going to have an overview of the anatomy and comparative anatomy, comparing the anatomy of an animal to a human, a dog to a human, a horse to a human. I did a whole series of comparative anatomy in my younger years, and boy, it really, really helped. The animals primarily that we work with are quadrupeds. We're a biped, so you can see how the form versus function has shifted and changed. And so you would start with, now this is not tested on the MBLEX. So you're not going to be asked to identify where the tricep muscle group is on an animal. But it is an excellent way to solidify your, here comes the birdies, solidify your knowledge of human anatomy too, by comparing back and forth. And in the online course that goes with this, your studies at Health Enrichment Center and companion to this chapter, and throughout the whole online course, there have been times when I have used comparative anatomy as a learning strategy. So here are two generalized pictures, one of a dog. Cats are similar, and then this is a horse. So, and then you're going to want to figure out how you communicate and with the person and also with the animal, mostly to identify the response. And so you never just approach an animal. You always work your way into that relationship. And isn't that a good idea with clients, especially people that may be a little bit more nonverbal? So the whole idea here is very similar to how we would interface and work with an individual too. There's an overlapping knowledge base. So a fun picture here. A side note, this lovely little kitty, when I was doing this photo shoot here, scratched me, and I had to use makeup on my arm during the rest of the photo shoot here. And this sweet little puppy was a puppy at the time this photo shoot was done, and is the puppy of one of my editors. So, and Lola is still with us, so that's really good. And these photos were taken quite a while ago. So, I mean, they're not dated or anything. So here are animals that can benefit from massage. Now, Luke is his significant other is a trainer, a specialist with leader dog as a working animal. And they are going to have some performance demand, and it's a stressful job. So even our outcomes are the same. So massage that is a systematic approach to touch with these service animals can help them also recover after a day of work. While I am filming this, there are the major fires out on the West Coast. 2020 has been an interesting year, to say the least. And I was looking at the news on that, and they're using horses to get as pack animals to get up into the areas that they could not otherwise get to. And those animals are heroes too. So we got our working animals, we got our entertainment and education animals. One of the leader dogs that swirls in my world was not able to be placed with a family because of persistent ear infections. So he is an ambassador dog, and he'll go and visit various groups, and he'll put the harness on, and well, somebody will put it on him. And he'll give people an experience of what it's like to be led by a leader dog. And so he's, he's part of an educational system. And we have a lot of comfort animals now in our society used for stress management and helping with anxiety. So here's your list. And then, interestingly, there's a tremendous amount of human benefit from learning how to massage an animal. So just keep that in mind in terms of teaching the caregiver, the human companion, how to massage their companion creature, and that can also have positive effects for them. So when you provide massage for an animal, it's no different other than you're probably not going to use a lubricant. So you're probably not going to use as much gliding. But everything else is pretty much the same. They probably won't get cold. They probably won't need to be draped. They may or may not lay on a massage table. I have had a lot of dogs. I've worked with a lot of animals in conjunction with working with a lot of athletes, because I go to the home and the animal is there and they want to be part of it just as much as the kids. So a lot of while my specialization may be considered athletes, because I am interfacing with the family, I have done work with animals, with grandma and grandpa and babies and the kids and prenatal and postnatal, and all of that has come into play as part of working with this one other population. So these are some of the common conditions that you might encounter. And of course, the specialists here are veterinarians. So whether you work directly with a veterinarian or you create a network relationship, you're still going to want to understand what veterinary medicine is, veterinary care, and you're going to want to understand what the treatment protocols are for these common conditions. And then you're going to want to be able to intelligently justify massage when you're speaking with this provider. So you still take a history and assessment. You're going to get most of that information from the human companion in the partnership there. This gives you an idea of how you will adapt, and a little bit of special consideration for horses, and then pain management, which is one of our major focuses. So that and stress management. So here are the pain behaviors for animals, the nonverbal communication patterns. And then we also have the medications and how we would adapt to that. So that is our segment on animals. And you can see that there's a tremendous amount of overlap between our animal companions and human population. So, and there's an innate wisdom required to work here, and a gentleness and a respect. And so you may want to move through this and pursue this more if that is where you have a strong intention. Okay. Okay, so that finishes up the topic on animals, and you'll see that the rest of the chapter follows a similar pattern. Okay, so our next is athletes. And in the massage world, unfortunately, there tends to be a little bit of an idea of status if you work with a professional athlete or high level amateur athlete. And talking about that gets into ethical concerns, because we have confidentiality issues. And then we can also have some ethical concerns related with treating clients equally. So if we are working with a client that we perceive has status, then we're apt to professionally interface with them differently. However, every one of these particular populations and every person individually is going to need unique adaptation. And so understanding the demands of a professional athlete or a high functioning athlete, just like if you're working with an entertainer, they have limitations on their ability to move out freely in public. That means they may not be able to get to your setting. They have scheduling issues. Scheduling that includes training and playing, and all of that is, whether you're working with an individual athlete like a golfer, or a team athlete like a football player, basketball player, a baseball player, soccer, it doesn't matter. There is a whole schedule platform that is very time consuming. And these athletes typically will work 6 days a week, including game day. And then on their day off, there are obligations for public appearances and stuff. So probably the biggest adaptation I made for the athletes I worked with was going to their home or where they were staying during games, and working at odd hours. So you can talk to Luke about that more now. I'm not directly working, well, I take that back because I do work with the Pistons. But my private practice now mostly consists of retired athletes that I worked with for a majority of their career, and saw them from their rookie status all the way through their career now as they are moving into their middle age. So it's an interesting thing. We also want to stop here and consider this idea of tactical athletes, which these individuals, I think, need our care a lot. And they don't have necessarily the financial resources to be able to have massage on a regular basis like a professional athlete. Amateur athletes, for that matter, don't necessarily have the financial resources. So I think I have a passion for our tactical athletes and our first responders. And I am aware of how the finances, the fees for massage, may need to be considered for these individuals that do so much. So just want to point that out. And experts are your sports medicine, physical therapists, athletic trainers, sports psychologists, lots of mental demand in conjunction with the physical demand that crosses over into the performance issues, which is way back we talked about the wellness wheel, and when we exceed and go into activities that demand so much of us that normal recoveries can't restore us. And that is also something to be considered with this. So the outcomes here are all of them, just like I mentioned in the previous chapter on a career pathway with sport and fitness. We certainly are looking at palliative care, the restorative care, pain management, local and systemic, and mobility. And so sometimes too much emphasis is put on the mobility aspect of working with this group and not enough on the restorative and stress management. We're really working in a therapeutic, in a condition management here. The condition that we're trying to manage is their physical function and the mental demand that goes with this. So I see athletes that have been overworked. The whole idea of orthopedic massage and all of that, that's, they already have, if they have a training staff involved with them, they already have people that do that. So the full body massage with a level of focus really is one of the most important things that we can give these individuals. There's also a little bit of shift in if there'll be, because of the physical demand, there'll be a increase in muscle mass and surrounding connective tissue, and there can be an underlying inflammatory issue that goes with this. You may have to consider things like delayed onset muscle soreness. Sleep disturbance is a big deal. And so the pressure levels and the methods that we choose, it might take more effort because of the density of the tissue on our part. So for us, ergonomics and body mechanics is really important. It is in all situations, but demands on us for more pressure because of the density, more force application in order to achieve the changes in the tissue because of the density of their tissues. Also, some athletes, not all, but some are bigger, and we also have to stop and consider that as well. I've had athletes that did not fit on a massage table, linemen in particular in football, or they hung off the massage table in basketball. And so that's also a consideration here, but that's not the only place where there is a consideration in terms of size and adaptation. So I worked a lot on a mat with the larger athletes, and they could relax and sprawl out. And if somebody is larger, there's always that underlying idea, is the table going to hold me, kind of a thing. So here's some examples of what the training effect is. Big issue here, and we don't want to interfere with that. We have to understand the repetitive nature of what this person's going to do. If they're going to throw a ball or swing a club or run down the field or whatever. We have to understand what that is and how that is demanding other than normal mobility function. And our functional mobility has to do with targeting daily life activities. And in this case, we have to realize that there is a training effect here that is going to pull them away from a norm, and we need to leave that alone and or support it. So baseball pitchers, for example, may have real hypermobility in their shoulder. A ballet dancer is going to have changes in their ankles. A gymnast is going to be hypermobile. So we don't want to interfere with that training, which will interfere with their performance. At the same time, we want them to function in their daily life as well. There is more of a tendency for tissue damage, just because of falls and twists and that sort of thing. And there is a lot of use of pain and anti-inflammatory medication. In addition, some athletes will use performance enhancing supplements and protein drinks and all of that kind of stuff. So if the person you're working with does that, then you need to be able to understand what the mechanism of action of that is, and then figure out what you're going to do related to adapting massage. Now, Medline Plus is your go-to on that as far as the medications are concerned and the general supplements, but it doesn't really look at some of the other concoctions that athletes will get into because they think it's going to make them perform better. So here are your common injuries, and these would require primarily a caution. So we're trying to not make the injury worse, and we're trying to avoid infection. So we have to clearly observe an area before we just routinely apply massage. Blisters are common, abrasions are common, and you may be the first one that sees that, because there's in many athletes, there's a tendency to be able to ignore some of this. And then we have overexertion. Sometimes that's called delayed onset muscle soreness. Sometimes it is related to repetitive use, which becomes repetitive strain. There's an inflammatory response, then it can deteriorate over time. So we have acute muscle soreness, delayed onset muscle soreness, stiffness. Muscles or soft tissue is a colloid, plasticky, viscous type of material. And if it sits still, like when you go to bed at night, you get a little thick and a little stiff, and then normal movement around or a gentle stretching program or a more gentle, a walk will start to increase the pliability of that tissue. With athletes, because they are so aware of their performance idea, there sometimes can be a reduced tolerance to that generalized stiffness. Now, interestingly, massage can do a lot with that. And so, but it's not anything special. It is just good thorough massage with variations of pressure and awareness to not increase any inflammation potential. The other thing that you may find in this population that you might not find as much in other populations is electrolyte imbalance. And sometimes they drink too much water, and then they'll start to cramp. The other side of that is that they may sweat so much that they have a fluid imbalance. And The cramps that come with that is not something massage can do anything about. They need to rebalance the hydration and the electrolyte balance. And so drinking just plain water may not do it. So they might have to have electrolytes in that. Pedialyte, for example, has electrolytes. And then if they have strain around a joint, for example, or there's a little microscopic tear and some connective tissue surrounding a muscle or something, then what's going to happen is that you consider that a hole, and muscle contraction is going to try to approximate those ends and close that hole. Now that's going to feel stiff and tight. And what they're going to want to do is, this is for anybody, they're going to want to stretch that out, which actually opens up the hole that the body is trying to knit back together. And so we have to be tolerant of the guarding, and it should resolve as a person gets into a second degree, the second stage, subacute stage of resolving the inflammatory response or healing a wound, whether you can see it or not, because if it's in a fascial lining around a muscle compartment, you're not going to be able to see that. Bruises are common, and you can do a very gentle lymphatic type drain over this, which will support the lymphatic system to take up the blood that has escaped into the area. What is very concerning and can show up in multiple situations, not just athletics, but is concussion. And any aggressive movements of the head, any head-to-head collision, any hitting of the head, a hard fall, you just have to assume that there has been some concussion-like response, and this can be cumulative, and you want to be really cautious about this. And some of these, the person can get hit, there can be an altered mental state with it, and then they feel fine, but there's a hematoma forming, and that might progress over a couple, 3 days, and then they end up with a significant life-threatening condition that sneaks up on you. So believe me, with the athletes I have worked with, I am very aware and have seen the consequences of concussions. So I don't take any head trauma or head shaking lightly. Here's an example of a fraying in a muscle, which is a tear in the muscle belly or at the ends. This is where you would certainly have some muscle guarding, and you don't want to stretch that. There needs to be a tolerance to that stiffness for a while. And this in here is, let me bring the size down a little bit. This is showing you where they're talking about some tendinitis, tendinosis, and some compression syndromes, and that's also common. I never can keep track of what is tennis elbow or golfer's elbow. One is on one side and one is on the other. It might even talk about it here. Tendon injuries are part of a muscle injury, but the muscle where the fibers are is very vascular, lots of that capillary network, less so in the tendon. And there's a place where the muscle cells themselves diminish and the connective tissue sheathing continues. That's called the tendonous, muscular tendonous junction right there. That's a weak spot. And that often you can get some injury right there, and it might be little minor, and so it will still cause healing and pain and all that, or healing and pain. It will cause healing. It'll cause inflammation and pain, etc. But it's so small. I actually have a squirrel sitting outside my window eating one of my tomatoes. So anyway, enjoy, little guy. So this repetitive strain type injury can be problematic. And athletes want to play, they want to perform, and so they don't often rest like they need to. So here's another common one is sprains and strains. This one right here, this first degree, this is the one where it's always a tension injury, and sometimes a tension with a torsion to it. You know you did something, but you can still get up, move around, walk on it. It might be real tender to point pressure, but it will cause some of the guarding and stuff that goes with it, and you don't always put two and two together. And so these are the sneakier ones. Second degree and third degree, they hurt. And so, and they'll swell, and there'll be a noticeable change in ability to weight bear and walk on it. Second degree will probably heal on itself. This is a hole. The hole needs to come together. It's difficult here because there's not a lot of actual muscle in here to cause contraction, because this is an ankle where most sprains happen. The knee is another, but also the wrist, to a lesser degree, the elbow. So, and it takes longer for these to resolve. And then this, depending on how close these ends can get together on its own, may require either some bracing or maybe even a little surgery to kind of knit these together. And the ankle needs form stability. It doesn't have enough muscle around there for there to be force stability. And so if this has been, an ankle's been sprained multiple times, you're going to get laxity in here. So that can be a progressive conundrum to deal with. Dislocations occur. You really have to watch for that. Most often it's the shoulder joint, the glenohumeral joint. But you can also have trauma at the joints related to the clavicle. So the sternoclavicular joint and the acromioclavicular joint. And if a person has had a dislocation, they usually know it, and it's part of the history. And I'm always cautious about too much laxity in that area. And you might have seen the massage methods where people put the arm behind the back to try to move the scapula. But when you do that, if there's been a dislocation, it's usually anterior of the shoulder. That puts that at strain. And so don't do that. If you're going to work with the shoulder, work it with the arm down. Don't take it behind the back and then pull the elbow down so that the scapula pops out. And then we've got this ongoing chronic joint pain that's cumulative. I have not worked with a professional athlete or a very committed amateur athlete or a dancer that has gotten out of it without a level of chronic joint pain and the surrounding soft tissue changes as they age. Additionally, this picture brings to my mind that the sports world is very multicultural. It's kind of like the military. Lots of cultures come together and interface and usually do it really well. So going back to cultural competence and truly seeking to understand the various cultural practices and questions to truly understand. I've worked with players that were from Samoa, and there is a tradition there that you remove your shoes, and shoes are an important part of stability and body mechanics and that sort of thing. And in the home, I always carried a designated pair of shoes that I only used inside. And but out of respect, I would remove my shoes for these individuals. So it's a good way of becoming comfortable in diversity by learning about the culture and then how an individual practices it. Okay, back on track here. We've got bursitis, which is an inflammation of a little fluid-filled pad around a joint almost always, but any place where something will rub and it adds a little protection, a little padding in there. And then you've got injuries to the bones. Fractures are not as common as you would think with athletes. But if there is a bone fracture, except in a couple of instances, it'll usually heal pretty good. Bone is very active material and it will renew. But it needs to be treated appropriately. And so the one that is sneaky is a stress fracture. They're very hard to diagnose. They can act like a sprain. They usually will heal on their own, but they're really, really annoying. And it makes somebody go, well, what's wrong? What's wrong? What's wrong with this? So pay attention to these. And if I suspect a stress fracture, I will refer and maybe they'll be able to see it. Sometimes you can't see these on x-ray until they've started to heal. Then there are nerve injuries, compression injuries from falling on it, and pulling injuries, like if the body is very twisted, or if the shoulder is pulled back or the head is knocked to the side. There can be a stretching on the nerves, and nerves don't like that. Postural change is usually due to performance demand. And so I would not be really concerned about postural symmetry with an athlete. I need to understand it certainly, but it's probably acquired. This gives you a schematic of performance demand and what happens with aggressive exercise. And then here's another chart here that gives you a comparison between the sport and location of stress fractures, which I've already mentioned are notoriously hard to diagnose. You also have to look at heat illnesses, hyper and hypothermia, both. When I've been at practices and it's been hot and there's been excessive sweating, I have noticed this, but I've also noticed it with the general category of clients that have been outside on a hot day and have raked the yard, and they also can suffer heat illnesses. And the weekend athlete, because they're not as conditioned as the professional athlete or the amateur athlete, they may be more prone to all of these conditions because they're not adapted to be able to tolerate it. So heat stroke can be life-threatening. This is a medical emergency, so you do need to have a general idea of this. And then the idea of ongoing care with an athlete. That's where we actually do the most. If you're going to just work with an athlete once, like in the previous chapter we talked about massage at a sporting event, you really got to be careful to not do very much. So, because you're going to unsettle their adaptive capacity, their performance demand, etc. Okay, so there's your key points on this, and we are going to stop this video here, and then we'll continue on in another clip. Okay, so you got a drift on how this is going to work as we go through here. And sometimes people say, oh, well, I need to work on an athlete to be able to learn sports massage. Well, experiences with people that are athletic as part of their wellness, or a hobby, or competitively, or whatever, that's helpful. But what I'm hoping you're going to see here is that it's very integrated, and just like working with a large client. Yeah, there are some athletes that are large, but there are people that are large. And so your adaptation for size is going to be similar regardless. There are athletes that by nature are small. Some of your gymnasts are very small. Your jockeys are small. Wrestlers, depending on what weight class they're in, they're small or they're big. And so whatever athlete you think you want to work with, you have to understand the periphery around what body type is more supportive of a particular athletic function. What is the relationship between stability and mobility in this? What is the repetitive action and the performance demand? What is their schedule like? Is it seasonal with a lot of activity and then time off, or is it more progressive? You know, what's the equipment like? So that's where your learning curve comes there. As far as a cross train is concerned, it gets a little dicey for athletes. maybe personal trainer. It's been my experience that amateur athletes, people that have athletics as a hobby, personal trainers do really well as a cross train. You can get into some dual relationship there, so you have to be careful. There is conflict in the professional sports world with personal trainers who their educational status is more of a certification. There isn't necessarily licensing involved with it, and your athletic trainers, as well as your strength and conditioning coaches that have bachelor's degrees and more behind them. And there's a conflict in there. So if you were going to navigate that, you need to be aware of that. And in professional athletes as well as amateur athletics, you need to know how to stay in your lane. You don't want to move into becoming a trainer or a coach or a athletic trainer or any of that. This is really an integrated system where everybody has their role, and if they stay in their lane and they communicate and cooperate, it can be really good or bad if people don't do that.